Om Shri Dhanvantare Namaha. Om Shri Gurudeva. Good evening to one and all present here. Jignasa is a pan-Indian initiative exclusively dedicated for Ayush students and Ayush education system with the aim of safeguarding the health and understanding the medical methods and theory that come under Ayush. Jignasa implements various student-oriented and society beneficial activities. Jignasa, with its motto, Learn Ayush to practice Ayush. Today, Ayush is gaining prominent portion in the global health system. So then, there is a need to empower our education system towards this global challenge. For this, Jignasa is trying to bring together the medical students, teachers, doctors, and administrators of Ayush system together in order to bring the desired changes. In ancient India, young seekers would approach learned sages with one burning desire to acquire knowledge and excel in their chosen path. The sages, in turn, would not only teach them, but also prepare them to apply their learning effectively in real life challenges. Inspired by this timeless tradition, Yashasvi Bhava, prepare, perform, prosper, has been designed as a beacon of guidance for second BMS students. This program is our modern day Gurukul, a comprehensive exam oriented series tailored to help second year BMS students master every subject with the support of expert professors. With features like dedicated doubt solving sections, model question paper practice, and daily classes aligned with the CBDC curriculum, Yashasvi Bhava ensures you're not only just prepared but empowered to excel. Let's begin this journey of preparation, performance, and prosperity. So now I'd like to introduce a speaker of today, Dr. Vasudev, Dr. Vasudev Anandrao Chate. I welcome you, sir. Dr. Vasudev Anandrao Chate, Professor, PG Department of Samhita and Sidhanta, Government Ayurveda Medical College and Hospital, Mysore. I'd like to hand over the session to you, sir. Over to you, sir.
Hello. Am I
Yes,
audible?
Yes, sir, you are audible, sir.
Sir, 1 minute, sir. I will check my mic. Hello. Hello.
Sir, you are audible, sir.
Yes, yes, yes. Can I share the screen? Hello.
Yes, sir.
Hello.
Sir, you are audible, sir.
Yes, can I share the screen? Can I start?
Yes, sir. You can share the screen and start, sir.
Yes. The screen is visual?
Yes, sir, it's visible, sir.
Oh. Yes. Good evening, one and all. First of all, I thank the team Jignasa for the creating this opportunity to the students to learn the um, exam, how to appear the examination as they are the trial batch. And I also thank Dr. Anand sir for suggesting my name for these presentations. So I will try my level best to give justice for this presentation. In this presentation, in brief, I will explain the content of the chapter. Along with that, some questions are there that also I will solve. How to write that questions if that question comes. After that, I will use some tips for that examinations. If any questions are there after completion of the presentation, you can free to ask. So here, the presentation is on Vimana Sthana and Sharira Sthana. So the specifically I have taken the allotted marks in as per the NCSM in these two sthanas. In the Vimana Sthana, MCQ 4 marks questions are there. For each question, that is 1 marks question from 1 to 3 chapter, and another questions from the 4 and 5 chapter, and next third question from the 6th and 7th chapter, and 1 question from the 8th chapter. Similarly, from the Sharira Sthana, 3 questions are there. That is first and second, 1 question, 3, 4, 5, 1 question, and 6, 7, 8, 1 question. SAQ, both are having the same weightage. So the 2 to 5 marks questions are there. That is SAQ questions are there. So first 4 chapters from the first 4 chapters, 1 SAQ question, and second 4 chapters, the another SAQ question, same. The distribution will be same for the Vimana and the Sharira Sthana. And for LAQ, only Vimana Sthana is given importance, and the LAQ questions are not from the Sharira Sthana. So the long essay type questions will not be from the Sharira Sthana. Only SAQ and MCQ questions are from the Sharira Sthana. So the first chapter is from Vimana Sthana. I will start the presentation from the Vimana Sthana. The first chapter is from Rasa Vimana Adhyaya only. The content of Rasa Vimana Adhyaya are importance and objective of Vimana Sthana. So this point is very, very important. Sometimes the first explanation they may ask for the 10 marks question also, or you may get it for the 5 marks. And Rasa Prabhava and effect of Rasa on the dosha, Dravya Prabhava. So 3 substances contraindicated for the long-term consumption and their effect on the body. साथ में अष्टविध आहार विधि विशेषायतन and आहार विधि विधान. These are the content of the Rasa Vimana Adhyaya. So keep remembering these all points. They are very, very important because in the Vimanasthana, SAQ questions along with LAQ questions are also there. So SAQ questions are the individual points may ask as the SAQ questions, and the complete chapter may ask as the LAQ questions. So explain in brief about the Rasa Vimana Adhyaya, or explain the importance of Rasa Vimana Adhyaya. So like that, they may ask the question. Hence, the content of this chapter is very, very important. The first point is Rasa Prabhava. So Rasa Prabhava on dosha only. Dosha Vata Pitta Kapha. So Rasa Prabhava is explained here. Here if you know the Ashtanga Hridaya Sloka, that is Tatradhya Marutanganti, Trayastikta Daya Kafam. If you don't know the Charaka Sloka, then you write it. So instead of writing this sloka, you write the explanation that will be considered. So here Vata Pitta Kaphas are there, and along with that, Rasa Prabhava is explained. Rasa Prabhava is explained on the basis of Samanya Vishesha Siddhanta, that is Ruddhikshaya. Along with that, one more concept is explained here, Prakriti Samasamaveta and Vikriti Vishamsamaveta, that also you do in the classical text. So after this, Dravya Prabhava is explained on the basis of Samanya Vishesha Siddhanta only. Here, the Dravya Samanya, Dravya Visheshas are explained with the Dravya Prabhava, and Guna Vishesha and Guna Samanyas are explained with the Guna Rasa Prabhava. The three substances contraindicated for long-term consumption, that is Pipali, and Lavan. The question may comes like effect of long-term, so you should go through in detail about this one. So what are the reasons are there and what are the contraindications will occur in the body, why we should not consume that one. Then the concept of satna will be there. Satna, there are three types of the satnas are explained, that is pravara, madhyama, and avar, considered as a pravara. If it is the 2 to 5 rasa abhyasa, then it will be madhyama, and 1 rasa abhyasa will be avar. So effort should be made to gradually move up from the avar and madhyama to the pravara satna. So this is the application of the satna in the first chapter. The same satna concept will be there in the 8th chapter also. So if question comes, that time you can merge first chapter and 8th chapter concepts, and you can write it for the 5 months. Trividha ahara vidhi visheshayatana, that is Karana, Sanyoga, Rashi, Desha, Kala, Upyoga,
But
Samaya,
as
Upyoga,
a
Adi,
cultural
Ek,
phenomena, it's one
Ahara
of the most
Visheshayatana was
fantastic
explained.
things on the planet. Because the last Kumbh.
Excuse me, hello. Any problem?
No, sir. Continue, sir.
So why it is explained means Matravad Ahara Aushada, the Phala is Shubha, and Amatravad Aushada and Ahara is Phala is Ashubha. Hence, the Matravat Aushada Ahara should be taken on the basis of that one. Ahara Matra, the Ashtavida Ahara Visheshayatanas are explained, along with method of taking meals are also explained. That is Ushtam Bunjit, Nigdam Bunjit, Matravat Bunjit, Chinam Bunjit, like that. The how to take the food method is also explained in the Charaka Samhita. Some previous year questions are here. That is what is meant by the term Rasa Vimana. This is short answer. For the five marks questions also they may ask. So in brief, you explain it. What is the Rasa Vimana? As it is open-ended question, that is Rasa Vimana. No particular things is asked here. That time the content of the Rasa Vimana you can write it in brief, so that will be sufficient. But the second question, explain Ahara Vidhi Vidana. So this is close-ended question. So Vidhi and Vidana both are asked in this one. So Ashta Vidha Ahara Vishesha along with Vidhi of taking, that is Ushnam Bhujit, so Snigdam Bhujit, like that also incorporated in the answer. That time it will be the student can score more in this one. Describe Ashtavida Ahara Vishesha Ayatanas. The direct question is there, that is closed-ended question. And in for 10 marks, they asked what is meant by the term Rasa Vimana. For the 10 marks, they have asked this one. Here, you write in detail about the Rasa Vimana with all the content of the Rasa Vimana. The next chapter is Trividha Kukshiya Vimani Adhyay. So here the content of the Trividha Kukshiya Vimana, 3 divisions of the Amasya, that is Trividha Kukshi, importance of Ashtavida Ahara Visheshayatana, Matravat Ahara Lakshana, Amatravat Ahara, concept of Ama, influence of mental status on the digestion, 2 types of Ama disorder is that is alasaka and the importance of dietary guidances that is in presence of health, prevention of the health, in the preservation of the health. That is, after this, some questions are asked by the Agnivesha, that is query about the site of digestion, description of amashaya, surface anatomy of the amashaya, and functions of the amashaya. This is asked by the Agnivesha. So the first, the three divisions of amashaya, this is very, very important. Matra and amatravat ahara depends upon the this first, this division only. How to calculate the quantity of this food. So on the basis of solid, and second part should be liquid, and third part should be kept open for the movement of the Vata Pitta Kapha. So what Matravat Ahara Lakshana? Here, the Matravat Ahara Lakshanas are explained on the basis of the time of digestion. First is time of digestion. If the Ahara consumed at night, it should digest within the 12 hours, that is morning. And if the morning consumed ahara, it should digest in the evening. Sayam pratascha ena parinamana. Hence, the first condition is the proper digestion should be there, explained. So on the basis of that one, matravat ahara should be assessed. If it is amatravat ahara, then it is of two kinds. One is hina matra and second one is ati matra. If it is hina matra, then first the sign is that there will be reduction in the strength, complexion, and there will be reduction in the nourishment of the dhatus also, and non-satisfaction will be there. Hence, Acharya explains the lakshanas according to the Vata Pitta Kapha. So you should check this one, Vata Pitta Kapha Lakshana. So next is Ama Pradoshaj Vikaras are explained. The Alasaka and Visuchaka are the Ama Pradoshaka Alasaka and Visuchaka are the Ama Pradoshaja Vikaras. So go through this one, Alasaka and Visuchaka. They are very, very important. And the important concept, the concept can be asked in the Nidana chapter also, Nidana syllabus also. So this is very, very important concept. Then Acharya explains about the Ama Visha, Nidana Samprapti and Lakshana of the Ama. After this one, so Ama Dosha Chikitsas are explained here. First is Upavasa, Sadhya Vamana with Savartis are explained here. After that, Apatarpana Chikitsas are explained. And very specifically, Hetu Viparita, Vyadhi Viparita, Hetu Vyadhi Viparita, and Hetu Vyadhi Viparitartha Chati Chikitsas are also explained in this chapter. So, digestive system with surface anatomy and functions of Amasya is explained here. So, the previous year questions define matra pramana of food. So both are explained, both are asked here. What is the matra and what is the pramana of the ahara? Pramana we are calculating on the basis of Kukshi, Trividha Kukshi, and matra on the basis of Lakshana, on the basis of this one. And so matra and pramana are also differs on the basis of the Agni. Agni is also plays very, very important. That is Mandagni, Tishtagni, Vishmagni, Samagni. So Mandagni, Tishnagni, Vishmagni, Samagni. So that assessment will be on the basis of power of digestion. So power of digestion, matra should be assessed, pramana should be assessed on the basis of Kukshi. The third chapter is Janapado Dhamsani Adhyaya. So Sambhashna Parishad, here one Sambhashna Parishad is there. After that, importance of timely drug collection, Dushita Vayu Lakshana, Dushita Jala Lakshana, Dushita Desha Lakshana, Dushita Kala Lakshana, and general measures for the management, general treatment in the epidemics, cause for the vitiation of Janapad Dhwasa factor, Adharma, the cause for the war and destruction. Kala Akala Mrityu, the role of Ushnodaka in Jwara, Apatarpana Chikitsa, and types of the Desha. These are the content of Janapada Dhamsa. The 5 marks question may come from any one of this one, and 10 marks question is there. Then they may ask for the Doshita Vayu Jala Desha Kala or directly Janapada Dhamsa. Direct question may come for the 10 marks. So, with the Chikitsa. So, Janapada Dhamsa with Chikitsa, they may ask for the questions. So, here, importance of timely drug collection. The why I kept this point because this question they may ask in the Viva also. What is the reason for the timely drug collection? Why it is explained in the Janapada Dhamsa? Or this is the important point you should note during the long essay questions of Janapada Dhamsa. The Agnivesha question regarding the why Janapada Dhamsa will occur, how it will occur. The Atreya explains on this one because of the Vayu Udaka Desha Kala. So after this, what are the reasons are there? So they explains about the Dushita Vayu is the reason, Dushita Jala is the reason, Dushita Desha and Kalas are the reason. And they explains about the Lakshana of Dushita Vayu Desha Kala. So the Lakshanas are very important. General measures for the management and general treatment in the epidemics are also explained here. Then cause for the vitiation of Janapada Dhamsa factor. The Tasya Moolam Adharma. Adharma is the Moola Karana for the vitiation of the Vayu Desha Jalakala. And the Tanmoolam va Asatkarma Urakruta Tayor Yonihi Prajnaparata. Prajnaparata is the Moola Karana for the Adharma also. So by doing the Adharma, the Janapada Dhamsa will So concept of Kala Kala Mrityu explained here in this chapter. So why this is very, very important means Kala Kala Mrityu is also explained in the Sharira Sthana. So when question comes, first judge it whether the 5 marks question is there from the Kala Kala Mrityu or 10 marks question is there from the Kala Kala Mrityu. If it is 10 marks question, then definitely it is from the Vimana Sthana. If it is from the 5 marks question, then assess how many 5 marks questions are there from the Vimana Sthana and Sharira Sthana. If only 1, 2 already Vimana Sthana questions are asked, then judge it is from the Sharira Sthana, otherwise it will be from the Vimana Sthana. So this bifurcation is very, very important during the writing of the exam of some concept that is Kala Kala Mrityu or Trividha Kala. But if you don't know, if you are unable to judge, then write it, no problem. It will be considered in the examination. The role of Ushnodaka in Jwara. So this is very specific explanation we are getting in the Charaka Samhita in Vimana Sthana, as the Ushnodaka explanation should come in the Nidana Sthana or Chikitsa Sthana, but it is explained in the Janapada Dhamsa. Hence, the concept is explained here. So, what is the reason is there? As asked by the Agnivesha, the reason for the Ushnodaka Pana is quoted in by the Atreya. And Apatarpana Chikitsa. So, there are 3 types of the Apatarpana Chikitsas are there: Langana, Langana Pachana, and the Dosha Avasechana. So, Langana, so Roga Avarabala, if it is Roga Avarabala, then Langana Chikitsa is sufficient. Langana Pachana, if Roga Madhyama Bala and Langana Pachisa is there, then it is Roga Pravarabala, then Dosha Avasechana is indicate. So types of deshas are Jangalanupa and Sadharana. So and here Roga also Alpa, Shascha, Sadharana, Samasadharano, Mata. In the Sadharana, there will be no disorder. Some previous year questions. Akala Mrityu. So Jala Dushita Lakshana. They may ask for the as Vayu Dushita Lakshana, Kala Dushita Lakshana, Desha Dushita Lakshana also. or they may ask 10 marks as a Dushita Vayu Deshakala Jal. All. Describe Janapada Dhwasa. They may ask it for the 10 marks question also. So write in detail Nidana, that is Karana for what is the definition of Janapada Dhwasa. After that, the Karana for the Janapada Dhwasa. After that, Mula Karana, that is Adharma and Pradhyaparada. And lastly, you write the Chikitsa for Janapada Dhwasa. Before writing the Chikitsa for Janapada Dhwasa, write the importance of collection of the medicines before Janapada Dhwasa appearance. So this point should be written. The fourth chapter, that is Trividha Roga Vishesha Vijnaniya Vimana, 3 methods for knowledge of the diseases. So the in detail about this one you already studied in the first year. So that is Pratyaksha Anumana Aptopadesha you studied in the first year. What is the difference here? What you should write in this year, that is when you come to the definition of Aptopadesha and Apta. So there in the first year, usually you write Rajastamobhyam Nirmukta Stapotjnana Baldine Desham Trikalam Amalam Jnanam Tattavyatam Apta Asista Vibuddhaste Desham Vakyam Asamsham. So like that you start writing about that one. But here that explanation is there in the Charaka Sthana 11th chapter, and that already completed in your first year essay 1. But you are writing the essay 2 examination. Here that sloka will not come. That's why you write this sloka, that is Aptaha Avitarka Smriti Vibhagavido Nishpriti Upatapa Darshanasya. So this sloka should come. And in the Pratyaksha, usually you write, you start writing about the Atmendriya Manoarthana Sannikasha Pravartate. But here, Pratyaksham tu khalu tadyat swayamindrer manasa cha upalapyate. So this is the definition. And last, Anumana. So here, along with Yukti, the Anumana is defined here. Anumanam khalu takka yuktapekshaha. So these are the definitions of the Trividha Pramanas or Trividha Parikshas, which are explained in the Vimana Sthana. So the complete entire definitions which are explained in the Sutra Sthana are different from this one. So Aptopadesha Gamya Bhava, already you studied in the first year, so no need of explaining this one. Similarly, the Pratyaksha Gamya Bhava, that is Srotrendriya Gamya Bhava, Chakshurendriya Gamya Bhava, Rasanendriya Gamya, Kanda, and Sparshanendriya Gamya Bhava. And lastly, the Anumana Gamya Bhavas are also explained. Agnim Charana Shakta, Palam Vyayama Shakta. So these all things are already you studied in the first year. So just highlight it and write it properly when the question comes from this chapter. The previous year questions, write tools for Rogi Pariksha. So here some doubt may come. In the Vimanasthana, Rogi Pariksha is explained in this chapter also, along with the 8th chapter, that is Dashavidha Athara Pariksha, are also explained there. So if it is confusing, then you write it, no problem. If you write the Dashavidha Rogi Pariksha, then also we will accept. And if you write the Pramana, then also it will be accepted. So the Trividha Rogi Pariksha, if the specific question is there, then write the Pratyaksha Anumana and the Aptopadesha. Or Dashavidha Athara Pariksha, direct question is there, then go with the Dashavidha Athara Pariksha. If Rogi Pariksha is there, better you write both the things, incorporate both the things here. So Pratyaksha Pariksha, the direct question is there. It is a close-ended question. Here the Aptopadesha or Anumana may come. Write the definition. After that, write its important or the assessment parameters of the Pratyaksha Pramana. And if the Anumana Pramana is there, or the question is for the 10 marks, then write in detail about the Pratyaksha Anumana and the Aptopadesha. The briefly explain Anumana Pariksha, the direct question is there. So the definition and Anumana Gamya Bhavas, you write. The 5th chapter, that is Srota Vimana. The content of the Srota Vimana are the Srotas, types of the Srotas, Sroto Mula, synonyms of the Srotas, Sroto Dushti Karana, Sroto Dushti Lakshana, Chaturvida Sroto Dushti, characteristics of Srotas, general principles of management. So read carefully this chapter because the same question may come in the Nidana question paper also. So Srotas, some general description is given with Yavanta Purusho Murtimantaha Bhava Vishesha, like that. So the number of the Srotas, innumerable number of the Srotas with Apichaika Srotasani Samudayam Shariram Ichanti, like that. After that, very specific explanation will be given in the Vimana Sthana with 13 types of Srotas because the 13 types of Srotas plays very important role in the the manifestation of the diseases and treatment of the disease. So assessment of the disease and treating the disease. These 13 types of the Srotas are very, very important. Hence, they explained along with the Moolas, that is Prana, Anna, Udaka, Rasa, Rakta, Mansa, Medasti, Majja, Shukra. Very simple to remember. The first Prana, Anna, Udaka, after that Saptadhatu, that is 7 plus 3, 10. Purusha, Motra, Sweda, that is 3 Bala. So totally 13 Srotasas are explained here along with the Moola, that is Prana, Dadaya Moolam, Mahasrotamcha. So like that, the Sruta Moolas are explained. So general etiology factors of vitiations are also explained with a specific one. So generally is aharasya viharasya stat dosha gunais samaha dhatabir vigunascha api sruta samsa pradoshakaha. So this is the general etiological factor on the basis of Samanya Vishesha Siddhanta. And specifically, next in the next slide, they have explained about the what are the karana for the rasa Vahasrotodushti, Raktavahasrotodushti, that also explained. So, how to assess the Srotodushti? Srotodushti. So, there are 4 types of the Srotodushtis are there. The disorders may be innumerable number, but the Srotodushtis are 4 only. There may be Atipravurti, Sangha, Vimarga Gamana, or Shirajakanti. The example for Atipravurti is Atisara, Sangha, Jvara, Vimarga Gamana, Raktapitta, and Shirajakanti will be Arsha. The specific Srotodushti Karanas are explained here. Prana, Shaya, Vegadharana, and Ruksha Ahara Vicharas are the Pranavas Srotodushti. Karanas are there. Similarly, the specific Karanas are explained in the 13 chapters, 13 Srotasas. The Srotos Chikitsa, the very typical Srotos Chikitsas are explained in the Charaka Samhita. That is Prana, Swasa Kriya. So Swasa Roga Chikitsas are explained. So that Chikitsa should be adopted on the basis of which type of Srotodushti is there, whether this is the Sangha or or Vimargagamana or Shirajakranti. So on the basis of that one, you adopt the treatment which is explained in the update. Udaka Krishna Chikitsa, Rasa Langhana Chikitsa, Raktamokshana Chikitsa, Mamsa Samshodana, Shastra Kshara Agnikarma, Meda Apatarpana Chikitsa, Asti Tikta Kshirabasti, Majja Shukra, Madhura Tikta Ahara, and Vyavaya Matravat. The sneha should be given. Shodhana Matravat Shodhana should be given. And Purisha, Atisara Chikisa, Mutra Kuchra, and Sweda. General cause for Srotodushti. So general cause, you write both the thing because 3 was question. Then if they write only general cause, would write both general and specific cause for the Srotodushti for the 5 marks. Give similar word to the Srotas. Now this question will not come for you because it is not a 5 marks question. So here, instead of this one, this may come in your MCQ question. So Srotas synonym may come for the MCQ question. And next will be Srotodushti, Pranavah Srotodushti, Lakshana and Sthana. So it is long essay question. Here, if you see the components, there are three components are there. One is Srotodushti, Pranava Srotodushti, and Stan of Pranava Srotas. If you distribute the bars in the three divisions, so first I distributed this one. Srotodushti, I have given the weightage for 4 marks as a Srotodushti. So details Srotodushti, how many Srotodushtis are there? Karana for the Srotodushti. So it will take the 4 marks. Pranava Srotodushti Lakshana. Before writing the Pranava Srotodushti Lakshana, we are writing the Pranava Sroto Mula, Srotodushti Karana, and Lakshana we are writing. So 5 marks weightage will be given for this one. And Sthana, so 1 marks will be given for 1 marks weightage will be given for this one. Totally 10 marks. So on the basis of Yukti, you distribute the marks according to that. For 6 pages, how many pages you should write? You only decide it and write it. So write it very specific. Explain the Rasavaha Srotas. Explain the Rasavaha Srotas. Direct question is there. And the general Chikitsa of Srotodushti. So general Chikitsa of Srotodushti are also asked in here. So it is also close-ended question. Direct question is there. So write as explained in the Charaka. So next chapter, 6th chapter, that is Roganika Vimana, types of diseases. The first justification for different types of classification, Sharirika and Manasika dosha and their visheshan, factor responsible for manifestation of innumerable diseases, psychosomatic diseases, primary and secondary diseases, 4 types of Agni, Prakriti, management of person having the different types of Prakriti. After this, 3 types of the patient based upon the dosha dominance, that is Vata dosha dominance, that is Vatala, Pittala, and Kafala Prakriti person, and characteristics of royal physician. So if the 10 marks question comes, that time you write all the content of all the which are explained in the Roganika Vimana. If 5 marks question is there, according to the sub question, the division, you write the answer. The first one is types of Roga, that is types of Roga on the basis of Prabhava, Sadhya Sadhya, on the basis of Bala, Mrudu Daruna, on the basis of Adhishtana, Sharira and Mana, on the basis of Nimitta, that is Svadhatu Vaishamya and Agantuka, on the basis of Ashaya, Amashaya Samuttanna and Pakvashaya Samuttanna Vyadi. And Acharya also explained that on the basis of Dukkha, it is only one. And if above explained the Prabhava, Bala, Adhishtana, Nimitta, Ashaya, permutation combination, the Vikalpa on the basis of Vikalpa, it will become innumerable in number. Dosha and Roga, the specific explanation is given here. The Sharirika and Manasika doshas are explained here. The Manasika doshas are Raja and Tama, and the Rogas are Kama, Krodha, Moha, Irsha, Mana. These are the Rogas. The similarly, Sharira, Vata, Pitta, Kaphas are the doshas, and Jwara, Atisara, Shopa. So these are the Rogas of the Sharira. One more very important concept explained in this chapter, that is the Paraspara Anubandha of the Sharira and Manasa Vikaras. So that is psychological disorders will convert into the somatic disorders. Somatic disorders will convert into the psychological disorders, or sometimes the somatic disorders will convert into the somatic, and psychological will be converted into the somatic only. That is Sharira, Sharirena, Sharira Manasa, Manasa Sharira, and Manasa Manas. 4 the Paraspara Anubandhas are explained here. The one more important concept explained here is the Anubandha and Anubandha concept. Anubandha is Swatantra and Pradhana, which will manifest by the reasons which are explained in the classical texts. So Anubandha is Apradhana and it is dependent on Anubandha Vyadi. So It is like a upadrav. The types of Agnis are explained on the basis of Mana or Pramana. On the basis of Pramana, there are 4 types of the Agnis are there. That is Tikshna, Manda, Sama and Vishama. Tikshna is Pitta Prabhulya, Manda is Kapha Bahulya, Sama is Tridosha Bahulya, and Vishama will be Vata Bahulya. So, along with its explanation of the symptoms are also explained here in Anumana Pramana, Agni Jarana Shakta, on the basis of Agni Jarana Shakta, Tikshna Manda Sama Vishama can be assessed. So here, Charaka explains the Prakriti, Vatala, Pittala, Sleshmala, very specifically for Mana, Pramana. That is, what is the importance of Vatala, Pittala, Sleshmala, Prakriti? Because so Vatala, Prakriti persons are having the Balavanta of Vata Roga, Pittala are having the Balavanta of Pitta Roga, and Sleshmala are having the Balavanta of Kapha Roga. And Chikitsa also same as Vata Dosha Chikitsa for Vatala with Vata Balavanta Vyadi, Pittala with Patta Balavanta Vyadi, Pitta Dosha Chikitsa, and Sleshmala with Kapha Balavanta Vyadi, Kapha Dosha Chikitsa are indicated. So Raja Vaidya characters are explained here. The 4 characters are explained. Sarvaroga Visheshajna. So he should know about all the rogas. Sarvakare Visheshavit. So he should know about the all the so Shodhana Shavana along with the Shastra Agni Karma. He should be well versed with this one. And Sarva Beshaja Tattvajna. He should know about all the Aushada. Rajna Prana. So he should save the Raja. So on the basis of this one, the 4 characters are explained. That is specifically 3 characters. That is he is saving the Raja Prana. Hence, I am considered he as a 4 characters. Some previous year questions. Kleshmala person. So they may ask for the Vatala, Pittala, or Kleshmala like that also. Or for 10 marks question, they may ask it for the Prakriti only. Write 4 types of Agni. So short answer question and explain Anubandha and Anubandha Vyadhis. So these are all are close-ended questions only. Directly you write the explanations. The 7th chapter, this is Vyadhita Rupiya Vimana. The 2 types of the patients based on the severity of the disease and clinical presentation. So improper diagnosis, what will happen if you improperly diagnose it? Types of krimi, that is Malaja, Shonitaja, Sleshmaja, and Purushaja, and principles of management, various therapeutic modalities. So here in this chapter, the krimi is very, very important. Krimi, concept of krimi is very, very important. So here Vyadita Purusha Bheda, Kuru Vyadita and Lagu Vyadita. This is also very, very important concept. Suffering with the severe disorder, Kuru Vyadita, but project himself or herself to be suffering from the mild disease. But Lagu Vyadita, they will project like they are suffering with the severe disorders. Hence, you should be a Vidya Vaidya that so whether they are Guru Vyadita or Lagu Vyadita and assess it properly on the basis of Dosha, Dusha, and Soto Praman, we stated Praman. So this on the basis of this one, Charaka classify the Vaidya into 2 types. Both are the degree holders, but one is Ajna and second one is Vidya Vaidya. The next will be Krimi, Malaja, Kapaja, Raktaja, and Purushaja. Their sthana, types, akriti, varna, and prabhavas are explained here. So Chikitsa for the Krimija Vyadi, that is Apakarshan with Chaturveda Samshuddhi. Prakriti Vigata with opposite Ahara Vihara and Nidana Parivartana. So specifically according to the patient. Vishesha Chikitsa for Krimi, that is in one day only, all the 3 treatments, that is Vamana Virechana and Astapana Bastis are indicated here. So it is given the first Basti should be administered. After that, the Ubhaya Ubhayahara Dravya should be Prayoga should be done. Ubhayahara Dravya Prayoga is Madanaphala and Pippalikwata along with Trivrit Kalpa will be there. So that is indicated. Along with this, Ballata Kataila preparation and administration method is also given in the classical text. Go with this one. They may ask for the 5 marks question. After that, Patya Patya as advised in the classical text. Previous year questions explain about the krimis and their general principles of treatment. So that's why I told this is close-ended question. Write in detail about the krimi. Along with that, the treatment modalities. After that, Guru Rogi, Laghu Rogi. Here, very specifically, they asked about the Guru Rogi, Laghu Rogi. So it is Guru Vyadhi and the Laghu Vyadhi. So, 8th chapter, very important chapter. That is the first Acharya explains about the Shastra Pariksha, Acharya Pariksha, Shastra Jnana Upaya, Trividha Jnana Upaya, that is Adhyana, Adhyapana, Tadvidya, Sambhasha. The question may comes for the 5 marks questions. Sambhasha Vidhi, that is Sandhaya Sambhasha and Vigrihya Sambhasha. So types of Parishat, Vada Marga, 44 Vada Margas are explained. Dashavida Pariksha Vishayas are explained here. The Dashavida Athara Pariksha, Panchakarmartha Dravya Sangraha, Madhurati, Shadrasa Skanda Dravyas, and Anupayogi Dravya Nishiddha. These are the content of the last chapter. Dashavida Pariksha Vishayas are Karana Karana, Karyoni, Karyapala, Anubandha Desha, these are the Pariksha Bhava. And Dashavida Athara Parikshas are Prakrutita, Vikrutita, Sara. Some previous year questions explain Vaya Pariksha. This is from Dashavida Athara Pariksha. Explain Dashavida Athara Pariksha in detail. So may ask for the 10 marks also. Detail Samhanana Pariksha, Tattva Sara Purusha Lakshanas are asked here. Then explain Sara Pariksha. So these are the some previous year questions. And the Shastra Adhyana, Tadvidya Sambhasha, Parishat. So so many questions are there. They may ask any question from the 8th chapter. After that, we are moving to the Sharira Sthana. So there are 8 chapters are there. Katida Purshiya Sharira, Atulya Gotriya. So the 8 chapters are there. And here one thing is there. Here you will get only 5 marks question, not a long essay questions. The Katida Purshiya Sharira. So Katida iti, how many types of the Purushas are there? On the basis of this one, this chapter is started with 23 questions asked by the Agnivesha. So how many types of Purushas are there on the basis of Dhatu Veda? 24. The Tattva Purushas explanation is there here. After this, Mano Lakshanas are explained. You know very well in the previous year only. You studied very well. Lakshana Manso Dhyanasya Bhava Abhava Evacha. Mano Vishayas. Mano Karma. Indriya Vigraha Karma Manaswasya Nigraha. So, Dhyanotpatti Karana. Indriya. Karmendriya. Mahabhuta. Prakriti and Vikruti. That is one Prakriti, Ashta Prakriti, Shodasha Vikara, and one is Prakriti Vikruti. What are the Avyakta Purusha or Rashi Purusha Lakshana? Pranapana Nimesha De Jivanam Manso Gati. After that, what are the cause for the disease? That is Alaukika Vyadhi and Laukika Vyadhi Hetu. So this is Laukika Vyadhi Hetu. Again, Trividha Roga Karana, that is Asatmindriya Yoga, Prajnaparada, and Parinam. And Alaukika Vyadhi Hetu, that is Naishtika Vyadhi Hetu is explained here. That's Upadahi Puro Hetu. Upada means Krishna and Ragatvesha. They may ask for the 5 marks question. Trividha Hetu for Roga and Arogya, that is Asatmendra Sanyoga Pratyaparada and Parinam. Adhisthana of Vedana, that is Mana and Deha are the Adhisthana of the Vedana. Yoga and Moksha, importance explained here, and the yoga importance is also explained with this explanation. So concept of moksha is explained in this chapter. Moksha rajastamo abhavat balavat karmasoksha viyogo sarvasanyoga punarbhava uchyate. Moksha by karma yoga explained here. The some previous year questions are the define pratyaparada, what is Shraddhatu Purusha, and what are the functions of the mind. So these are the close-ended questions. Direct questions are there, like that. Some other question may. Next chapter is Atulya Gotriya Sharira. Atulya Gotriya Sharira. So here in this one, the characters of Shukra is explained. Characters of the Shukra is explained. That is, it is created by the six rasa, and it is having the four pada, that is Vayu, Agni, Jala, and the Prithvi. After that, Acharya Agnivesha asked the question, what is the reason for the delay conception for the three is not Vandya? So such questions they may ask in the examinations. After this, the how to determine the sex determination questions are also explained here. Query about the gender abnormalities are also explained in this chapter. After this, Satyograhita Garbhini Lakshana, very, very important. Tick in your book only, very, very important. Satyograhita Garbhini Lakshana. So, signs of female baby, male baby, and the transgender. Query about the migration of Atma, that already you studied in the first year as a Ativahika Purusha. So, the same explanation will be there. Purusha Bala and Daiva Bala, important concept. After this, some factors are explained here to maintain the health. That is, Narohita Ahara Vihara Sevi Samikshakari Visheshva Saktaha Tata Sama Satyapara. So, this they may ask in the Vivos. Some previous year questions, that is right, Satyograhita Garbhini Lakshana. So, these are the some questions asked in the previous year. So, that is the direct question. Kuddaka Garbhava Prantiya Sharira. So, here how the Garbha Utpatti procreation will occur. So, this is explained in this chapter. Factors responsible for the Utpatti of the Garbha are 6. That is Matruja Bhava, Pitruja Bhava, Atmaja Bhava, Rasaja Bhava, Satmaja Bhava, and Sattvaja Bhava. They are very, very important for the Utpatti of the Garbha. So, these 6 factors are important. For the Nasha of Garbha also, these 6 factors are held responsible, because any lacuna in the 6 bhava, there will be destruction of the Garbha takes place. That is Garbhopaghātakara bhava also opposite to these 6 only. The chapter number 4, that is Mahati Garbhava Krantiya Sharira, the question regarding the embryo, how Garbha will origin, and the definition of Garbha. Its composition, the 6 factor composing the fetus, that is Panchamahabhuta and the Atma. Masanamashika Garbharuti is explained in the 4th chapter. 4th chapter is very, very important. 2 very important concepts are explained here, that is Masanamashika Garbharuti and Manasika Prakrutis are also explained in the 4th chapter. So, give more importance for the 4th chapter. So, Pratama Masa, Dvitiya Masa, Tritiya Masa. In the Tritiya Masa, Panchabhautika Lakshana will origin. Panchabhautika Mahabhuta Lakshana will appear in the Garbha. So here, on the basis of that one, Acharya has introduced the Loka Purusha Samyavada in this chapter, but in detail about the Loka Purusha Samyavada is explained in the fifth chapter. After this, Dauradi Lakshanas are explained. The very important concept, they may ask it for the 5 marks. Garbhini Lakshana. So when Dauradi Lakshanas are explained, after that, Garbhini Lakshanas are explained. In the previous chapter, they explains about the Satyograhita Garbhini Lakshana, but in the fourth chapter, they explains about the Garbhini Lakshana and Daurudini Lakshana. Application of Daurudini. So when the question comes along with Daurudini Lakshana, you write the application, that is, you fulfill the desire of the pregnant lady. So this point is very, very important. After that, Chaturtha Masa, Tiratva Prapti, Panchama Mamsa, Mamsa and Rakta Ruddhi will be there. Shashta Mamsa, Balavarna Ruddhi, so Saptama Mamsa. All round development will be there. Here the possibility of the delivery will be there. Ashtama Mamsa. So this is very, very important. In the Ashtama Masa, Astira Ojas. So if delivery occurs, then it is dangerous for the fetus. Navama Masa. So this is time for the delivery. Cause of its growth. So why the growth will occur? It is explained with the Swabhav Samsuddhascha Kuksho, along with the Shadbhava, Swabhavata, the Garbharuti will take place. So cause of destruction of the embryo due to the presence of opposite property of the Garbharutikara Bhava. Atma Swarupa, it is Paramatma Swarupas are explained in this chapter, that is Nirvikara Parastatma Sattva Nirvishesha. Again, Sharira and Manasika doshas are explained in this chapter to explain the Manasika Prakriti. Here it is, Manasika Prakritis are explained. Satvika, Rajasika, and Tamashika Prakritis are explained. So Satvika Prakriti is quoted as a Shuddha, Shuddham. Okay, in multiple choice question, you may ask, they may ask like this: Shuddham is the Prakriti related to Sattva, Raja, Tama, or Vata. Like that also they may ask. Okay. So here Satvika Prakritis are explained here with the signs and symptoms. After this, Rajasika Prakritis are explained with the signs and symptoms, and Tamasika Prakritis are also explained with the signs and symptoms. The previous year questions, enlist the Manasika Kaya. So the question is like this: enlist the Manasika Kaya. So Manasika Prakriti also they may ask directly, explain the Satvika Prakriti, Rajasika Prakriti, or Tamasika Prakriti. Like that also they may ask the Garbhini Lakshana, Daurudini Lakshana, Masanumashika Garbharuti. So many questions may come from the fourth chapter. So make it as a important chapter. Next, the two chapters are there. In the fifth chapter, Acharya explains about the Purusha Vichaya Sharira, and the sixth chapter will be Sharira Vichaya. So here, the in detail explanation about the Atma, and in the sixth chapter, in detail explanation about the Sharira is incorporated. So here, the first Acharya explains about the Roka Purusha Samya Vivechana. So you already studied in the first year. So the same explanation is also here. And after that, Pravritti and Nivritti Karma. Pravritti is nothing but Punarjanma. Here Punarjanma Karanasa, Ahankara, Sangha, Samshaya, Abhisamplava, Abhyapata, Vipratya, Avishesha, Anupaya. And the Nivritti, nothing but Moksha. So Jnana Yoga, Karma Yoga, and Mukta Atma Swarupa is also explained in this chapter. Previous year questions discuss the similarity of Loka Purusha, so that is Loka and the Sharira. So maximum the same question may come. The Pravritti and Nivritti, so consider it as a may not ask in the as it is considered with the philosophical aspect. They will ask with the Lokapurusha Samyavada. Sharira Vichaya Sharira, the 6th chapter. So here, detailed explanation about the Sharira, Sharira, Chikitsaka Kartavya, Sharira Dhatu Guna, Sharira Vruddhikara Bhava, Bala Vruddhikara Bhava, Ahara Parinamakara Bhava, Garbha Sharira Vichaya, and Kala Akala Mrityu. Again, in this chapter also, you will get the Kala Akala Mrityu, as it is also explained in the Janapadodhamsa. So here, so many 5 marks question may ask from this chapter. That is, Sharira Vruddhikara Bhavas are there, Bala Vruddhikara Bhavas are there, Ahara Parinamakara Bhavas are there. So these are the probable question from the 6th chapter. So Sharira, the definition of the Sharira is explained here. Tatra Shariram Nama Chetanadhishtana Bhutam Pancham Mahabhuta Vikara Samudayatmakam Samayogayamahi. So Chikitsaka Kartavya, so on the basis of Samanya Vishesha Siddhanta, Adhikam Apakashyati Nyunyam Apyaya. If it is decreased, then increase it. If it is increased, then decrease it. Ruddhavata should be decreased and Kshinavata should be increased. Sharira Ruddhikara Bhavas are explained. Kala Yoga, Swabhava Sausiddha, Ahara. So these are the Sharira Ruddhikara Bhava. And Bala Vruddhikara Bhavas are explained here. Desha, Janma, so Kala. So these all are there. They are considered as a Bala Vruddhikara Bhavas. So Ahara Parinamakara Bhavas are explained here. The Ushma, Vayu, Kleda, Sneha, Kala, Samayogascha iti. So these are the Ahara Parinamakara Bhavas. Specifically, Acharya explains about the Garbha Sharira Vichaya. So the fetus, some concept or some importance of the fetus are explained in this chapter. Which of the organ of the fetus is manifest first in the womb of the mother? These are the questions asked by the Agnivesh. Which food nourishes it and how does it comes out? So these are all the questions. What is the span of its life? So these all are the questions asked by the Agnivesha and answers also beautifully explained in this chapter. After this, Kala Kala Mrityu concept is explained in detail. Some previous year questions. Write Balaruddhikara Bhava, enlist the Balaruddhikara Bhava or Sharira Ruddhikara Bhava. As I told, some more question may come from this. Sharira Sankhya Sharira. So already you studied in the anatomy, first year anatomy. So Tvacha is there. First question is Tvacha, first explanation. After that, Anga Vibhaga, Asti Sankhya, Panchendriya Adhisthana, Pranayatana, Oshtanga, Pratyanga Vivechana, Rasadi Dhatu, Manas are explained here. So main questions are Tvacha, Mana. Previous year questions explain the Tvaksharira. So as I told, Tvaksharira, this is the possible question from this chapter. The last chapter, that is Jati Sutriya Sharira. Jati Sutriya Sharira, that is Garbhadana, Garbhini Charya, Putreshti Yajna, Pumsavana Karma, Garbhastapana Dravya, Garbhopaghatakara Bhava, Garbhini Chikitsa, Dosha Yukta Garbha. There are Amaja Garbha, Upavishtaka, Nagodara, Dina Garbha, Udavarta, Mrita Garbha, and Chikkasa. So these are the Dosha Yukta Garbhas. These are the Dosha Yukta Garbhas. They may ask for the 5 marks or they may ask for the 10 marks also this question. So detailed explanation is there. After that, Suti Gagara, it may come for the 5 marks. Prasava Vidhi, so they may ask for the 10 marks also. So read properly Prasava Vidhi. This will be helpful in your next year also, that is in the Prasuti and Striloka. Complication in the Prasava and its solution. Sadhya Prasava Balaka Paricharya, that is Nala Chedana Karma, Chata Karma, Raksha Vidhana, and Sutika Roga Chikitsa. So these all explanations are there in the Charaka Samhita only. So after that, the Kumara Paricharya is explained. Kumara Paricharya, Kumara Gara, Dirgayu Balaka Lakshana, Dhatri Pariksha, Stanya Sampat, Ashuddha Dugdha Lakshana, Stanya Dushti Chikitsa, Kshira Jnana Janana Dravya, Dhupana Karma, Mani Dharana, Kridanika, and Kumara Chikitsa. So the question may come from the Kumara Paricharya or Kumaragara, directly Kumaragara or Kumara Paricharya or Sutika Paricharya or Sutika Gara also. So the most important chapter, so many questions may come from this chapter. So here the question in the previous year, enlist the Garbhastapana Dravya. Garbhastapana Dravya has 6 explanation are there. The Matruja, Pitruja, Bhavata are there. Those all are Garbhastapana Dravyas. So before concluding my session, here some tips for the examinations I listed. First, before starting your writing of examination, carefully read the questions and put the question number on the question answer paper. So question number, what is question number is given in the answer paper is not matching with your answers. So put first question number on the middle of the answer sheet. So that is very, very important. After that, put question number before writing the answers. Carefully read the questions. So 5 minutes you spend for the reading the questions only. Observe the subdivisions in the questions, as I told in the previous question only. If it is the Srotas or anything, so see the subdivisions in the questions. After that, distribute the marks according to the weightage. So you only distribute on your yukti, distribute it and write it. Write the reference if you know firmly, not mandatory. It is not a mandatory one. Write the reference. If you know the reference, write it. So don't write it is from the Rasa Vimana Adhyaya, reference from the Rasa Vimana Adhyaya. It is Charaka Samhita paper. We should write it, the reference. No, it is not like that. It is not a reference to context question. It is a question given there. You write the examination. The evaluator want answer, not pakka the references. So here they are not asking for the references. If you know, you write it. If the question comes like that is Kala Kala Mrityu, then the multiple references are available. That time you write it. So the explanation is available in Vimana Sthana as well as Shareera Sthana. Like that, you write it. So by that, the evaluator will come to know that the student know about both the explanations. So after that, if it is Srotas, then direct question is there from the Srota Vimana. If it is Rasa, then Rasa Vimani Adhyaya. So like that, the direct, the chapter name also you will come to know by the question only. So if it is like that, then you write it. Try to minimize the mistakes. So you know your mistakes in the first year. You very well know your mistakes, but don't repeat it here. Don't repeat in the second year also. So try to minimize the mistakes. Use more schematic presentations and tables along with the description in the examination. My complete presentation is on tables and schematic presentation only. The very limited description I have given here. So I also suggest you to use the tabular form, tabular explanation along with the schematic presentations and write the description also if it is 5 marks. If it is multiple choice question, then direct answer will be there. So manage time. Time is very, very important. So after completion of the examination, all are the putting only one this one that sir time is not sufficient, sir time is not sufficient, but you manage your time. So here time is also allotted, the pages are also allotted. We are not asking you to write more than 50 pages. So speed up the writing. write with the tables, schematic presentation, and that is your way of presentation. So how we will present. So on the basis of that one, you can score more. Up to 80, 85 also you can score with beautiful explanations. Sloka should be precise. So when you are writing, don't write in for all the chapters or for all the questions. So writing only one. Vata Pitta Kapha Sthiti Trayodosha Samasata. Vata Pitta Kapha Sthiti Trayodosha Samasata. So don't write like that. If you know the specific sloka, that is Srotas is there. Then if you know the Srotas sloka, that is Apijeka Srotas Samayos, if you know it, you write it. Otherwise, write explanation. So that also acceptable. So by this, I conclude my session. Once again, I thank the team Jignasa for giving the opportunity. And I also thank Dr. Anand Katti sir for the considering my name for this session. So any doubt you can ask. Yes, Tejas Kumar, am I audible? Tejas? Yes, Tejas, Sridevi, Chaitra.
Sir, you are audible, sir.
Any doubts are there?
Thank you so much, sir.
Thank you.
On behalf of Jignasa, I would like to extend our heartfelt thanks to Dr. Vasudev Anandrao Chate sir for delivering such an insightful and engaging presentation today. We truly appreciate the time and effort you put into preparing. We truly appreciate the time and effort you put into preparing and sharing your expertise on the subject. Thank you so much, sir.
Thank you. Thank you so much.